Do you remember when you were younger, the kiss of your parents would magically heal the pain?
Placebo effect. Placebo literally translates to I will please in Latin, and nowadays placebos are really just treatments that have no true medical effect. You know, like sugar pills, saline injections, and even surgeries. Yes, you heard me right. Surgeries in which the doctors puts the patients under anesthesia, cuts them open and suture them back up again without doing anything. With placebo, you're mimicking the action of taking a medication, but there's no active ingredient. So it's pretty weird that a lot of the time, placebos actually work. But if the patient is not receiving any medication or treatment, how's that even possible? Let's get in depth of this mystery. Prefrontal cortex, an area of the brain responsible for high-level thinking, can integrate context clues surrounding a placebo, and these include 3. Behavioral, the act of taking a pill or receiving an injection to improve your condition. Secondly, social, reassuring body language, eye contact, and speech from a doctor or nurse. And lastly, verbal, listening to a healthcare provider talk positively about the treatment. Prefrontal cortex can then connect to other brain regions that are responsible for neurochemicals, like dopamine, which signals pleasure, oxytocin, known as cuddle hormone, and opioids has a strong calming and anti-pain effect. In response to the placebo effect, all these neurochemicals increase, causing even more opioids to be made. These neurochemicals ultimately signal down to the spinal cord to say, hey, pain has been managed. The brain can also regulate other things after placebo treatment, hormone production, and immune responses in the brain region called hypothalamus. The real takeaway here is that brains are complex, and different approaches from therapy to medication to pure mental strength can be effective and useful. Now, don't you feel better just knowing how placebos work?